Well, hi everyone. I wanted to kind of give everyone, I guess, a journal of upcoming things that I've got going on. This is obviously about hip replacement surgery. I've been going with two bad hips for 4 years, one of them being closer to 10 years. 10 years, the 10-year one, which is my right hip, I've dealt with that one for the longest time. It restricts me, but it doesn't create a huge amount of pain. It will tighten up if I try to walk or do too much. Whereas my left one is acute pain, like every day, no matter what I do, walking, sitting, whatever. So there's that. The surgery is on the 7th, so it's about a week and a half away. I've been approved for it. They're going to do the anterior approach. And I'm creating this so in that way people have a real expectation of what they might face. They're doing the anterior approach, which is nice because it has less restrictions, hopefully a better outcome for me because I still play hockey. Posterior has a lot more work that you have to do to get back to be able to do stuff without dislocating. So I'm glad it's anterior versus posterior, simply because of the less restrictions and whatnot. But to give you an idea of the issues that I have, ultimately, the problems I have basically have anything to do with the hip, bending the hip. So bringing my knee up, that's as far as that goes. It's so little that I can still touch my toe on the ground. And to give you another idea, flaring to the left or right, that's as far as that goes. You should be able to put it all the way out over here. And I can't do that simply because the restriction stops so early. Sitting down 90 degrees is okay, but anything at 90 degrees or more, or I should say less, it creates a lot of pain because it's starting to go past the restriction. And, you can kind of imagine anyone that's had hip problems, you probably very well aware. So I can't walk around the block because it starts to tighten up a lot. It's almost like sore muscle at some point, except it's a lot worse. And like anyone that's had issues with their hips probably know. So this is to kind of show you where I'm at currently. I want to do one the day of surgery when I get home, day after, and as days go by. So in that way you can kind of see a real example of what you might expect. I'm only 48 or 49, I should say now. Doctor thinks that's young for surgery, which most people get them older in life, but so comparative to that, I guess, that's accurate. But I'm looking forward to it. I'm kind of scared, not going to lie. I don't like the idea of my body parts not being in my body, kind of. So there's that. But I'm looking forward to be able to do things that a normal person can do, like put on your own socks, bend over to pick something up, things like that, where I can't really do that. I can. You don't want to see it. It's a train wreck. Simply because trying to put your socks on, you can't just bend over and do it. You have to like kneel on the floor and reach behind you to put it on. It's a nightmare. Riding bikes is difficult. Using a rowing machine is difficult simply because it bends the hips too much. But yeah, I will give updates the day of, day after, and for the rest of that week. So that way you can just kind of see what has happened. But I've got a few friends that have had it already, and it's always the same thing. Oh, I wish I would have done it sooner, or it feels amazing. It's all the same thing. But yeah, we'll see how it goes. Now what kind of movement my leg does have. I'm excited to compare it to afterwards, but we'll see what happens. And we'll go from there. If you have any questions, let me know. I'll try to answer them the best I can. But we'll see you in the next one on the 7th.